Healthcare reform is necessary because we should have healthcare coverage for everybody. Healthcare is too critical to people. It's virtually up there with food, with family, with housing as one of the most critical things for people. I think the main push should be to have the entire country have access to quality healthcare coverage. It should include moving toward full coverage for people. It should move toward eliminating pre-existing conditions as a barrier to insurance. It should move to eliminating lifetime caps for healthcare reimbursement. It should make insurance more portable. It should also facilitate individuals who are hard-pressed financially in terms of being able to get healthcare insurance, and also be sensitive to small business people for whom it can be a very substantial burden. I think healthcare policy can help make people healthier by ensuring that the health centers stay very strong, that they're there to take care of patients, and that they have enough resources with which to do it. You want to do healthcare right. You want to do it at a high quality. In addition, I think that healthcare policy can also insist that the consumer takes some role. Healthcare is influenced by providers, but it is also influenced by the way we take care of ourselves. Do we smoke? Do we take care of diet? Do we exercise? Do we go for colonoscopies when we should? Do we go for regular healthcare exams when we should? If we as consumers are given treatment suggestions, do we follow them? All of those things are important. The fact that somebody does what they're supposed to do, sees their doctor, gets their medication when they leave a hospital or a clinic, means it's less likely they're going to come back to the hospital for an unnecessary hospitalization. Academic health centers play an enormous role in healthcare. They train many of the clinicians. They are the ones who educate those doctors. They provide a model as to how healthcare should be delivered. They help train and keep practitioners in surrounding areas informed by continued education. They do a tremendous amount of research on better treatments, comparing treatments, finding new treatments, finding new ways of doing procedures. For example, the whole move toward minimally invasive surgery has been conducted within academic health centers. One of the things we're doing at New York Presbyterian is we've created something called My NYP. And what that means is you can put all your healthcare information into one repository under your control, and you can have it accessed anytime you want by whatever healthcare practitioner you're seeing anywhere. And that means you don't have to remember, did I have this, did I have that, how do I get my EKG records? They can all be reproduced under your control to the practitioner, and they can give you more rapid and a higher quality care. I see that as saving money. Malpractice right now can result in cost to doctors, which is enormous. It can be a couple of $100,000 a year, and it is crippling some of the medical fields. Obstetrics, for example, is a profession in which many people don't want to participate. They don't want to join it because they're concerned about the cost. The cost of obstetrical care has gone up primarily because of that. If we could do something about reform that would reduce those costs, in addition, it would also reduce defensive medicine. And people are doing, or doctors are doing all kinds of extra tests to make sure they're covered in the event of a lawsuit. If the likelihood is that a lawsuit is reduced in possibility or in frequency, the doctors will do less in terms of defensive medicine, and you can get enormous savings from that. So my feeling is that malpractice reform should be a part of any major health reform. I would say to my grandkids that a number of the people who are in the government are trying to figure out how to make sure that health care is done better, how to make sure that health care is available to everybody, and what they're trying to do is figure out the right way to go, which would hopefully bring down the cost of health care somewhat, but also make it better, and as a result, enable you to live a longer, healthier life.